just can't figure this out lah. Oh my god, bang! Look at this! Did you know that an octopus has 3 hearts? Oi, can you not? Orang tengah gagal tau. Maybe you should take a break, you know. You've been so busy this past few months, no time to layan me even. Breaks my heart, you know. Shut up, please. Ish. Suit yourself lah. Rasa macam heartburn tu. You okay? Oh, that feels so good. Hey, apa jadi dengan tu? Jap, let me call ambulance.
Filled with illness and disease, Arif is on a quest for informed health. Presenting My Health, My Choice. One host, 27 experts. About health issues in Sarawak.
How am I supposed to know all this? How dare you say like that to an older lady? You simok lah. You okay? Hey. Lomba bis.
Listen. Do you recognize this sound? Though we don't hear it all the time, we can always feel it when we are calm, stressed, or how about when we listen to a song we like?
Our hearts keep us going every day, and with every pump, it supplies oxygen and nutrients throughout our body. It's pretty cool if you ask me, considering it's only the size of our fist. Though it's this small, it does so much for us. But what about us? Are we doing enough to keep it healthy? It's easy for us to get swallowed by our daily activities. With our busy lifestyle, we rarely catch ourselves a break. And even if we do, it's hard for us to stay consistent at it.
What has now become termed as hustle culture has been a norm in our society for a very long time. In our youth, we are encouraged to strive extra hard to achieve heights in our lives, such as in our studies, career, and relationships. Social media has romanticized overworking and sacrificing time and wellness to work hard and play hard. But the more we push ourselves, it is our bodies that take the toll, including our hearts.
Studies have shown that by overworking can increase our risk of heart attack. When we prioritize the hustle, we lose sleep, we don't eat properly, we choose things that is convenient rather than healthy, and that will affect our overall health. The Malaysian Employment Act states that the maximum hours of work is 8 hours per day, 6 days per week, making it a total of 48 hours in a week. But in Sarawak, I wonder how is it?
In this episode, Arif meets Dr. Ho Kien Hui, a consultant cardiologist and a cardiac electrophysiologist at the Sarawak Heart Centre. Using the power of imagination, Arif also speaks to another guest. Professor Dr. Sim Kui Hian is a senior consultant cardiologist at the Sarawak Heart Centre, who is also a Deputy Premier in the Sarawak Cabinet.
Dr. Ho, from your experience, could you share with us Are Sarawakans overworked?
So some individual, they work a lot, right? And some actually is not. When you overwork, you actually has less time spent on, healthy lifestyle, like you go for exercise or those things, right? And also, in fact, you don't have much time taking care of yourself, right? Eating quality food, spending good time with family members, right? And with this, eventually it lead to heart problem. Yeah.
In the context of individuals who lives in more urban areas, or a bit more busy area, for example, the hustle culture is getting more and more common. And from your point of view, what do you think about the hustle culture?
As long as they can manage their time well, they can spend some time, taking care of their food, taking care of their lifestyle, right? Engage with some exercise or those things, control their blood pressures, control their diabetes, cholesterol properly, stop smoking. I feel that the urban people are more knowledgeable, right? But however, despite the awareness, the problem with urban city population is that they don't have enough time, right, to engage in all these activities because they are being too engaged in their work.
The health of our hearts has a lot to do with the pace of our lifestyle. The hustling, the bustling, pretty common for people who live in the city, right? But what about people who live in a bit more relaxed environment? Heart problems doesn't come that often? That's not the case. In recent years, there's been more and more cases of heart diseases in rural areas, and it continues to be the #1 killer in our country.
In the rural area, there's actually less hustle, but they don't have the knowledge. They do not know the importance of taking medicine, the importance of taking good control of these diseases like hypertension, diabetes, cholesterol, and this ultimately actually lead to heart disease.
Arif wonders what Dr. Sim might say.
A lot of people in the rural area used to work for food. I mean, they had to go and catch, hunting for animals, they plant their foods, they have a lot of exercise. And then that's why they used to be having not as many heart disease as now. But now, because the roads are ready, all the modern lifestyle from urban, with the accessibility, they have picked out all these bad influence. And as a result, the rural and the urban are going to have the same numbers of heart disease burdens as compared in the past.
Arif thinks that Dr. Sim brought up an interesting point.
How can we bridge that knowledge gap in urban or even in rural areas?
I feel more awareness programs, of course, have to be set up. They need to really spend time, manage their time properly to engage in all these activities, and then being able to timely go for medical checkup if they suffer from any illness or any sickness.
Why do you think it's very, very important for them to raise this awareness?
In rural area, I noticed that a lot of time when they have sick, for example, in terms of cardiologist wise, if they have chest pain, sometimes they just try to ignore the symptoms, telling people this is nothing, this is maybe it's too heaty, or too cold, right? That lead to this discomfort. But in fact, sometimes they have this silent heart attack that was a lot of time being ignored. And when they seek medical consultation, it's often too late. Logistics is another issue. Because of our huge land in Sarawak here, a lot of people stay far away from places like hospitals that they can actually reach out. Sometimes they don't have this transport to allow them to see doctors immediately when they feel unwell. So this is also another issue that we face in Sarawak.
My health, my choice. Your health, your choice. My health, my choice. Your health, your choice. There are many different types of heart disease. All of them takes time to develop. Often enough, it goes unnoticed because it doesn't show on the surface. By the time it shows symptoms, it could already be at an advanced stage.
Let's see how Dr. Sim explains it.
About 25% heart attacks, right, they never have any symptoms, they just die in the sleep. And 75% of people who have some form of symptoms. And when you say heart attack symptoms, classically chest discomfort, pain when you stress yourself, and the pain is dull aching pain, not sharp pain. And the pain doesn't go away even you rub on it. So I urge people to be on constant lookout for all this discomfort, because you're never too young to get a heart attack. For male, it's on average 56 years old. For female, it's on average 62 years old. This is very young.
So if you could share with us, what are some of the early symptoms that we could watch out for so we could get medical attention early on?
Sometimes you have heart problem, but you do not actually feel any symptoms, right? Sometimes some of my patients actually have a severe blockage in the heart vessels, but they do not actually feel any symptoms until they exert themselves. So regular checkup is very important for every one of us, especially when we reach the age of 30 and above. We need to watch out for symptoms like chest pain, shortness of breath, easily get tired, sometimes even leg swelling. This may actually indicate that you have some heart problem. Different symptoms relate to different heart diseases. Some individuals have palpitations, and some individuals actually have jaw ache or even just sweatiness. I would say as long as the symptoms, this is not as usual symptoms, and you feel that it comes again and again, I think that it's time for you to seek for medical advice.
The heart is actually, you look at the heart, it's like a house, right? You got the wall, you got the artery, which is like water pipe outside, and then inside the heart, you got the valves, we call the door, and in between the muscle, the wall, it is a wiring. So I always said the wall here and the valves, which is the door, are JKR, and the wiring in the middle of the wall are SESCO. And then what happens is the artery is like waterboard. So what actually happens is, as a new house, the water pipe is always very clean. But after 60 years, right, the water pipe will get rusty. So for us, the same thing happens. Our artery, which is a water pipe, as it get older, it get rusty, it get blocked. When it block, if it block, it means that the heart muscle die, not getting enough blood, they die. And when it dies, it means the heart don't pump. And your brain, after 5 minutes not getting enough blood, your brain start to die, and your kidneys start to die. And that's why heart attack is a medical emergency. That's why we want to make sure that the artery is unblocked. It's unblocked so that the heart can start pumping again. So that is what we call heart attack. But sometimes, because you got 3 main arteries, sometimes small arteries get blocked, so certain part of the heart just die. It doesn't affect the whole heart, but then you get heart failure because your heart becomes weak. That part who die cannot pump again. And of course, another very common form of heart disease is a SESCO issue, in which this one is what classically people call palpitations. If you feel the heart pop, 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 it's a bit like our electricity. Sometimes and the light flip, 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 flip. It's the same thing. The heart disease actually is the artery getting blocked. And heart attack means that the artery, they don't get blood, the blood cannot flow to the rest of the heart muscle, and the heart stop pumping. And when the heart stops pumping, there's no blood pump around the whole body, and then you're in trouble.
Now back to Dr. Ho.
Dr. Ho, could you explain to us a bit more about palpitation?
A lot of patients having palpitations was diagnosed wrongly as having anxiety. When we see our patients, sometimes they've been given anti-anxiety medication, and they're being labeled as anxious patient and all those. But a lot of time palpitations are real because they have palpitations because they have a syndrome called arrhythmia right in the heart. Means that they have some electrical problem in the heart. This is very important to be identified because some of the palpitation actually can be cured by a simple ablation. Of course, some of the palpitation cannot be cured easily, but it's important for us to identify it because one of the diagnosis for this palpitation is atrial fibrillation, which if we ignore that, this atrial fibrillation actually can lead to clot formation in the heart. And this clot formation, once is being ejected from the heart to the brain, it will cause stroke, a massive stroke. So this is what we want to prevent. That's why I feel it's very important for an individual, right, who has palpitation to seek medical advice and to sort out their palpitations, and instead of being labeled as anxiety or anxious.
So following up to that, in terms of getting medical advice, who should we go to?
If an individual has palpitations, and of course, if let's say they've seen any doctors and was being diagnosed as anxiety, of course, sometimes regularly they're being prescribed anti-anxiety. If they have any doubt on the diagnosis and in fact the symptoms is not well controlled with the medications, I feel that they need to actually have open view to consider seeking another advice from different doctors or even different cardiologists, so that it can be identified properly.
My health, my choice. Your health, your choice. My health, my choice. Your health, your choice.
To improve our understanding of heart disease, Arif decides to play a round of myth or fact. Myth or fact?
So first one, heart disease affects more men than women.
True, because as what we see, right, not from me, but this is from the census globally, the ratio of heart disease from men and women, it happens like 80% and 20%. But when the individual get older and older, of course, the incidence of ladies getting heart disease is increasing. But generally speaking, heart disease occur more in men than in women. Another reason to support this possibility, because of the smokers, you can see most smokers belongs to men. Some people say that it's because related to these estrogens hormones. Women have it, but after the menopause, in fact, the incidence of them getting heart disease increase.
So my next statement, heart disease, it does not affect to the young and fit individuals.
Myth. Recently, we have encountered a lot of young and fit individuals having sudden cardiac death, and especially you have seen that a lot of sportsmen, sometimes they experience sudden cardiac death as well. So basically, to define an individual young is easy, but to define an individual being fit is not that simple. In different age group, we have different category of heart disease. Some individuals think that they are young, right? They smoke, they look fit, right? They do exercise, but they're very heavy smoker. They do encounter problem with artery blockage as well. The earliest, the youngest patient that I've seen is 16 years old with just 5 years of smoking.
All right, Dr. Ho, my next statement, surgery is a fix-all solution for all heart disease.
This is a myth, all right? Of course, surgery itself is not fix-all for all. For examples, like if you have severe blockage of the artery, by opening the heart, by fixing the blood vessels, the blockage is still there. It's just to relieve your symptoms, to buy you some time for you to maybe live a bit longer. But if you're not taking medicine, you're not controlling the risk factors like diabetes, hypertension, and you continue to smoke, eventually you have repeated heart attack. But of course, some of the surgical procedures can actually fix some of the problem. Some of the palpitations actually can be fixed by surgery, and it can be cured.
Dr. Ho, what would be some practical advice do you give to audience, the viewers, or even some of your patients to take charge of your heart, take control of your heart health?
Treat our body as vehicle. Okay, the heart is basically just like our house, just like our building. We need to take care of the plumbing system, take care of the electrical systems, take care of the doors, right? Take care of the walls of the heart. Of course, each and every one of us being gifted, with a heart, right? And we cannot actually decide how will the heart look like. We are born with it. But with the heart itself, as we know, the house or the vehicles will age. So before it get into serious problems, we need to maintain it. And how to maintain the heart is that if you have any symptoms, do seek medical consultation as soon as possible. But if you have no symptoms, try to control all the risk factors to prevent you from getting a heart attack, like blockage of the vessels. Right, before it gets blocked, try to maintain the quality of the water in the pipe, taking care of the blood pressure, make sure the quality of the blood is clean. If the sugar is high, to reduce the sugar, to control the sugar, take care of the cholesterol level, stop smoking, very important. Right, stop vaping as well, very important. Take care of your body size. That's, I think, one of the ways that we can improve our heart health.
So, during emergency, in the case of like heart disease, who can we call?
Any emergency, call 999. Before you know that this is heart disease or it's not heart disease, if you feel unwell, the symptoms are getting more and more serious, try not to ignore the symptoms, right? Just directly go to the nearest hospital as soon as possible. This is very important because, as what we usually say, time is equivalent to your heart muscles. So if you have a blockage of an artery, you have symptom of chest pain, and if you don't attend immediate medical attention, you delay it for a few hours, you have more heart muscle injury because the heart muscles basically is suffocating, and ultimately you get damaged. So if you delay yourself from seeing medical advice, then ultimately you may suffer from heart failure.
Any input from Dr. Sim?
Especially if you are diabetics, right? Diabetic may not have chest pain, and so a lot of people did not realize it. You get medical checkup, but if you have all this discomfort and really feel unwell and start sweating, right? The first thing you need to do is to take aspirin, because it means get blood clot, blocking out your narrow heart artery. And our heart artery is so small, it's about 2 to 3 millimeters, which is smaller than a straw. And so it doesn't take a lot to get blocked. So you need aspirin because you need to dissolve the blood clot. And so you take one tablet of 300 milligrams of aspirin, and then you chew it. If you swallow it, right, it takes a long time to dissolve. You chew it, and then it is faster to dissolve. Hopefully, by the time you reach the hospital, some of this blood clot dissolve and save your heart. So don't take it lightly, but because we got such a good facilities, we can at least save you and give you another chance to live. That's most valuable. I mean, our heart center, our clinical research center in South General Hospital are well recognized, not only in Malaysia, but in the region. For our heart center, we are the 10 cardiac services of Ministry of Health, and 8 in Semenanjung, 1 in Sabah, and 1 in Sarawak. Over a period of 22 years, cardiac services and cardiac centers has treated more than 245,000 Sarawakian. So that is a large volume of people in a public system. And that is not surprising because we said that the heart disease is #1 disease burden in the whole country, including Sarawak. When we started 22 years ago, with just 2 million annual funding a year, and with about 50 doctors and nurses, 22 years later, this heart center funded 200 million, more than 800 doctors and nurses, and the waiting list continue to grow. We have been talking that there's a need to set up what we call satellite heart center, so that at least emergency procedures can be done in those centers. The more complicated procedure still come to the main heart center. So that's why we still have a gap, and Sarawakian aspiration is at least we are given the same numbers on doctors. This is constantly improving. Now we're given 1 doctor to 662 Sarawakian. Our ratio of 1 nurse is to 342 Sarawakian. For the nation as a whole, most of the doctors are actually in private. Sarawak only has 4,262 doctors and 606 in private. This is unusual. It shows that Sarawakians are very dedicated. We just want to serve our fellow Sarawakian.
Awareness and swift action is key to preventing heart disease and its fatalities. So, take it easy on the heart. And remember, in any case of emergency, call 999.
Every heartbeat reminds us that we are still alive. Learning how to take care of our hearts will be one of the most precious gifts that we can ever give to ourselves, because it is what helps us to survive. Remember, My health, my choice. Your health, your choice.